I call the member for Boothby.
Thank you, Mr Deputy Speaker. Last Friday there was a rally at the Repatriation General Hospital in my electorate. 600 to 700 people gathered to express their concern and outrage at the South Australian Government's plan to shut down this iconic hospital. This was the last day of the state government's sham consultation. In early February, the Premier Jay Weatherill launched his new health plan with great fanfare, calling it the biggest transformation to South Australia's health system we have undertaken. How long did the state Labor government give the public and the medical community to comment on this important plan? Just 24 days. Contrast that with their next consultation, announced just 2 days afterward, on whether or not South Australia should change its time zone. They clearly believe it's much more important to hear what the public has to say on the time zone, because that consultation is still ongoing, with no particular rush to finish. I'm sure it's purely coincidence that over those 2 days, when there was a massive public backlash over the state government's plan to close the Repat, and the time zone consultation is being run by Minister Hamilton Smith, the only Minister for Veterans Affairs ever to close a veterans hospital in his own electorate. The South Australian Labor government are now only listening to the advice they want to hear. Both the Australian Nursing and Midwifery Federation and the Australian Medical Association have said that their health plan lacks meaningful detail and they have not had a chance for proper consultation. Doctors and nurses in the public health system are being gagged from criticising their plan and banned from speaking out against changes they think will have a serious negative impact on South Australia's health system. I'm aware of a number of staff at the Repat who believe that shutting down this hospital is a terrible idea and will compromise patient care, but who don't want to be named because they have been put in fear for their jobs if they do. One of the things the Health Minister said is other states no longer had a Repat hospital. Simply not true. New South Wales still has a repatriation hospital at Concord. There is the Heidelberg Repatriation Hospital is part of the Austin Hospital in Victoria. I could go on. So anyway, last Friday, South Australians rallied at the Repat to tell the state government what they think of their plan. And just because state Labor's consultation is officially over, that does not mean we're going to stop fighting to save the Repat. If the doctors and nurses aren't allowed to speak up for themselves, we, the Liberal Party of South Australia and residents of the southern suburbs, will speak up for them.